Hey there, welcome to week 5, drug quiz number 4. Let's get started. Our first drug is a combination medication called buprenorphine with naloxone. Its brand name is Suboxone. It's available in tablets and also a dissolvable film. It's typically used for narcotic addiction, so people who are motivated to quit their addiction will get started on this medication and slowly get tapered off of it if they're successful. Interestingly, plain buprenorphine is also used for pain relief. So it is a narcotic opioid blocker, but it still has some narcotic in there. So it just tends to not have the effect of a high of a narcotic that people would want from the other narcotics that they get addicted to. All right, next, flip the page here. Phenazopyridine is a very common pain reliever for bladder spasms. Most commonly, it's an analgesic. Brand name is Pyridium, although you can also buy it in low dose over the counter in a product called Azo. And now you can find it generic over the counter as well, but the higher doses are prescription only. Next one is lidocaine. This form is actually the patch known as Lidoderm. So it's a local anesthetic. It's got a numbing property about it. You've probably heard of lidocaine. It's used for all sorts of things. There's patches available over the counter as well, but of course the prescription ones are a little bit higher strength. Then the next group of drugs, we get into psychiatric drugs. All of these next few are antidepressants, SSRI antidepressants, which is actually selective serotonin reuptake inhibitors. So basically what that means is they are blocking the reuptake of serotonin out of the system to try to keep more serotonin in the system, because serotonin is kind of one of our happy neurotransmitters that can help with depression. So the first one is escitalopram. Brand name is Lexapro. Next one is paroxetine or Paxil, also an antidepressant. Again, these are all in the same class of antidepressant, as you guys can see from your books. Then we have fluoxetine, which is Prozac, also occasionally known as Serafem. A very high dose tablet was made, a 60 milligram dose, which women will sometimes take for severe premenstrual dysphoria, which is just severe menstrual depression and symptoms, so it can be helpful for that. Then we have venlafaxine, which is Effexor, citalopram, which is Celexa. You may notice that sounds a lot like escitalopram, because it is. When you actually look at the chemical structure of some of these medications, they have like a crystal structure, which is bulked up with all these other fillers to make a tablet. But under a microscope, almost all of these chemicals will have a mirror image of each other, and those are called isomers. And the escitalopram is actually just one of the isomers. So that's the S isomer of citalopram. There is some thought that it's more effective because you don't have both isomers that the body is dealing with, but really, this class of medications is very patient dependent, so a lot of people end up having to try several in order to see if they will work or help them. So, interesting little factoid there. Then we have sertraline or Zoloft. And last for the week, it's on the top 200, but we don't see too much of it. I used to see it a lot somewhere around 15 years ago when I was working in mental health. It's called fluvoxamine or Luvox. So that's it for the week. Good luck on your quiz.